Laura Mize, pediatric speech-language pathologist, and welcome to Teach Me to Talk's podcast. Today we're continuing our 8-part podcast series, Building Verbal Imitation in Late Talkers, and we're all the way up now to level 7 in this process, and this is so exciting because we're finally ready to talk about how to teach kids to imitate words. But before we get going on that, let me remind you that you can get a CE credit, 1 hour of credit for this for $10 in our $10 CEU program, and the link for more information about that and to enroll is below here on YouTube. If you're listening on your podcast app, you can get more information about that at Teach Me to Talk, my website, and this is course number 428. When you do purchase that CE credit, you'll get a handout. Now, this one's actually 2 pages full of information, and it's such a nice summary of all that we're going to talk about in today's show. All right, so we already said that we're going to talk about teaching a child to imitate new single words, but here's the kicker. We can't just dive straight in at this word level with kids who are late talkers, because for many of those kids, this level is simply too hard. And how do we know? Because they're not doing it for you. Maybe you're the parent of a late talker and you already have your child in speech therapy, or maybe you're considering that. But you know with your own efforts that you have tried and tried and tried to get your child to imitate words, and it's just not happening. So if you've stumbled on this video or just kind of jumped in mid-series here, we've been discussing a very sequential process to work late talkers up to this level for being able to imitate single words. But before we get to all that, let's start this show the same way that we've started the previous shows in the series, and let me give you 3 really important things that I want you to know about teaching a child how to imitate single words. Number 1, and I've said it almost every show in this series, imitating is how all kids learn how to talk, whether they talk late or whether they talk on time. So if a child isn't talking yet, there's a very, very, very good possibility that he or she hasn't learned how to imitate as easily or as often as he or she should. And again, this is what this whole series has been about. Number 2, and this point is specific to today's show, we should only focus on teaching a child to imitate single words when he's achieved a fairly high level of mastery imitating other easier, earlier levels of imitation. And if you've been with me throughout this whole series, you know what those are. We've already said we can't start with words. We have to start with imitation out here. We'll walk through that in a minute when we look at our graphic and kind of see where we are in this process. But just for now, no, we can't just jump right in here with late talkers because we've already said that that's too hard. We have to work them up to this process. And so this leads me to my 3rd point. If these strategies aren't working for you after you've watched them and tried to get them going, you know, again, that the reason is the goal is too hard. So you've got to back up to those easier, earlier levels of imitation and then move a child forward so that he's able to imitate single words. All right, as I just talked about, let's go ahead and check out where we are in this process. So let's take a look at this graphic. Now, these are the levels of imitation. And again, if you have been following this series pretty sequentially yourself, you're familiar with this graphic. And so we look at the first level of imitation there, and that's where a child learns how to imitate out here. Remember, we said that it kind of moves up through your body, and that's a principle that we have of all gross motor development. And after all, speaking or speech really is a form of a motor or a kind of a motor activity. So when we think about that motor development happens, gross motor first, about here kind of whole body. And so we talked about doing that and teaching a child how to imitate actions with objects, and then body movements that we eventually shape into communicative gestures. And then we talked about how that's going to move up his little body to his face and his mouth. And some kids have to learn how to imitate nonverbal movements with their mouth first. But lots of kids are ready to go straight to that level 4 where they are imitating play sounds or vocalizations in play with their little mouths, but they're not necessarily words yet. Then we make it just a little bit harder in levels 4 and levels 5, where we teach a child how to imitate play sounds and exclamatory words. And then in our last show in 427, we looked at having a child imitate some familiar single words, but only in really specific context that we taught them in those verbal routines like ready, set, go, 1, 2, 3, up, 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 all those little routines that we talked about back in show 427. So now is when a kid is really ready to move up, and we get to real words. And again, there are lots of reasons that a late talker may have such difficulty learning how to imitate words here at this level. And the biggest one by far is that simply he has not mastered that learning how to imitate those easier, earlier levels first with his body, things that he does that don't have anything to do with his mouth. He learns the process of copying. And we already talked about how we see that in typical development. We see kids learn how to copy things that their parents do. And this whole entire process of learning how to imitate words, and then even bumping up to the next level, which is phrases, which we'll talk about in the last show in this series. You'll see kids have learned how to do this. Babies have learned how to do it all by the time they're here at functional words. And we know with typical development that most kids are using a word or two by the time they have their first birthdays. And so even by phrases, by the time they hit 18 months, and kids are spontaneously generating phrases from their single word vocabulary. They've imitated phrases earlier. So if you look at this whole process, this is what they've learned how to do in their first 15, 16, 17, 18 months of life with language development. But it doesn't just all start here with words. And so when we know that we have an 18-month-old or a 24-month-old or a 3-year-old who's not using words, he's stuck somewhere back at these easier, earlier levels of imitation. Some kids are way down here at level 1. They really aren't connected enough to people to be able to watch them long enough to do what they do. And so what we have to do, again, that we've talked about now from show 421 through now with show 428, these last 7 shows. So we talked about how to help a kid move through this entire process. So if you've just, again, stumbled on this show, teach me to imitate words, and you are looking at this as your starting point, I hope that I'll help you see that you're probably going to need to back up and look at a level that comes before this one. So if we see that a child's not doing some little things like fake coughing, or you try to get him to imitate some fun little movements in a game, like a song like If You're Happy and You Know It, he's not clapping, or if he's not filling in any little words for any routines you have, and I've already given the most familiar one with ready, set. If he doesn't say go there, you've got some work to do at those easier, earlier levels. So go back and watch show 422 where we talk about imitation. Even fast forward to the end of show 422 where I help you pick out what your starting points are, and we walk through that handout. And you can get yourself a copy of that handout with 422 as well, where you look and you figure out exactly where the child that you're concerned about is functioning, and then you meet him there, you strengthen imitation there, and then you move on through this chart. As we like to say at Teach Me to Talk, you fill in the chart, you move a child through that process, and then you get to words. But for those of you who have been with me, you're already here. You already know this process. You've been working with your child or working with children on your caseload, and you've gotten them here. You're seeing and hearing imitation, again, at levels that are easier than at these single words. And so for kids who are completing words and verbal routines, and they're imitating these other kinds of play sounds, they're ready. So let's move on and talk about now exactly how we teach a child to imitate new words. And remember, imitating is how all of us learn everything, especially how to talk. And so we've got to get a kid there, and we, for the 15th time in this show, let me just say, we do it by moving them through those easier, earlier levels. All right, so let's do what we've done in the other shows videos as well and take a look at how this looks in typical development. So a baby around 1. And so now I'm going to show you a new baby that we haven't seen before. This is little Caroline, and this is when she was turning a year old. Her mom and I were friends. Her mom's actually a physical therapist, and so she hears me talk about this, or at that time heard me talk about this a lot. And this happened with her little girl, and so she was so excited, and she wanted me to have this video. So here you go.
Do you want more? Do you want more? More. Are you all done? All done. Are you all done? All done.
See, imitation happens so early, and that's the kind of thing that we really need to keep in mind when we're working with our late talkers. It doesn't matter that a child that you're working with now at 2, at 3, at 4 missed these levels of imitation then, or maybe they did them and they had some regression. We've got to go back and pick those up. But as SLPs, especially when we're working with children who are 2 and 3 and 4, sometimes we do just want to jump straight to words. We don't even think about all these other prerequisite levels that have to come first. So if you are in that position, I want to give you some super specific guidelines that you can use that will tell you definitively if a child is developmentally ready to move toward focusing on single words, where you as a speech language pathologist, an SLP, know that you can work on words and that, again, you are focusing your attention at the right place. So the number one prerequisite for using single words as the main goal in your speech therapy sessions is, number one, interaction is not a problem. So what do I mean by that? I mean there are no social skills concerns. No, the social interaction development of that child is not in question. He is connected to you. He is looking at you with eye contact. He exhibits wonderful joint attention. And what do I mean by joint attention? That means that you are both looking at, talking about, doing the same thing. And a lot of times kids who don't have joint attention are really just kind of, they're seemingly almost to self-isolate because they don't always include other people, and sometimes that's even more subtle than you think. Let's say that you are going to give a child a drink. You have his sippy cup and you're trying to reach out to give him his sippy cup. Well, lots of times with kids who do not have interaction skills and social skills emerging as we would hope, their attention is all focused on the cup. They never look up at your face. And you can try to kind of test it today if you have a child like that you're concerned about. When you're trying to hand them something or give them something, move it over a little bit, move it around, see if they ever break their gaze from that object, and then you'll know, gosh, he's not really including me with this. He's just focused on getting what he needs. And again, will we see that with kids with typical development? Absolutely. But at the same time, they're also looking at you. You start to move their cup around like they can't get it. They're going to look at you like, hey, you're playing a joke on me. Or, hey, why are you doing this? Give me the cup. Quit being a jerk. You know, that kind of thing. And so you'll see that they will use their facial expressions and so and their body language. And again, they don't even have to use words for you to know, gosh, they think I'm teasing them when they're doing this, so because they're laughing or smiling and their little eyes are so twinkly, or this is upsetting to them. And you know, they'll give you those kinds of that kind of feedback too. You'll see, you know, a little like, I don't understand why you're doing this to me, you know, that sort of look. And so and they're looking at you to do that. And so with interaction, you know, aha, they get that I'm part of this equation here. They are including me in this. And so that's what I mean when a kid does not have good joint attention. He's so focused on the other thing. Lots of times he's more focused on objects than people. And we know that this is a big marker for a kid who's at risk for autism or will get eventually an autism diagnosis. And so when we are concerned about a child's engagement or his level of interaction with other people, he's not developmentally ready to learn words. And why is that? Because communicating always involves at least two people, and it starts at a real nonverbal level. Like all of these things that we've talked about. We've talked about how imitation starts as a nonverbal skill when kids are doing things with their bodies or things with toys, and before they get to imitating sounds and words. And so it's the same thing with social interaction. They do it, they demonstrate that they're moving along that social skill continuum by looking at you, by staying with you, by engaging in that experience with you. So if you are struggling to keep a child with you during play, and I don't mean just physically running away from you, but really with you, really noticing you and watching you and responding to you and initiating communication with you, then he's not ready to talk yet, not ready to use words. And that would be from a social perspective. You've got to get those social skills moving first. All right, so let's talk about that second prerequisite for when kids are developmentally ready to focus on learning single words as your main goal in speech therapy. The second part of this is cognition. Their cognitive skills are moving along. So what is cognition? And what does it have to do with language? Well, parents think about cognition, or the layman kind of way to look at it is how a kid learns. How does he remember? How does something you taught him yesterday, has he retained that to today? How does he generalize knowledge? Can he take something he learned in one specific little scenario and then use that again with something else? You know, a good example would be he's learned how to push a button on a toy to get that toy to activate. So does he see other toys with other buttons to see immediately? Know, oh, hey, maybe I should push the button. Or the same thing, opening a door. There's a handle here. Should I pull this handle open? So those are the kinds of things that we see in a child who's learning, he's remembering, he's planning. He can see a toy, or let's make it about a daily routine. Let's say he's eating breakfast with mom, and she gives him a yogurt container, and he doesn't have a spoon. A kid who's at about that 12-month level, who's starting to feed himself with a spoon, he knows, hey, I need something here. I'm not going to just be able to, turn my yogurt up. Although a kid might try to do that, and that would be trial and error, and that would be fine. But my point is, he plans. He knows there's something missing here. I need that spoon. And that's going to be more obvious as kids get older. But again, you're going to see that. Now, why is cognition a word that a speech pathologist would be concerned about? Aren't we only worried about talking? Here's the truth. Language is built on what a kid already knows nonverbally or cognitively. And so if we have a kid who's really struggling to learn those really basic cognitive milestones like object permanence and cause and effect and simple problem solving, when we have kids who are struggling there, their receptive language isn't going to be what we would expect it to be either, because what is receptive language? Receptive language is what we understand, or the words that we hear and that we know what that word means, because we've already linked meaning with that previously. And so when a kid's cognitive skills are delayed, his receptive language skills are always delayed. And so you'll never have a kid with cognitive issues that doesn't have an issue not only with talking, but with understanding. And so that's super important, because we can't expect kids to be able to use words communicatively until they understand them first. Now, they may be able to imitate them. They may be so verbal that that's not a problem. And this happens with typical development too, because, a kid will be able to sing a song or quote something that he doesn't understand. But we'll see it a lot, particularly in kids who go on to be diagnosed with autism, who are echolalic. And so they are just copying what you say with no real regard with how to use those words communicatively. And so we have to think about those things. And we know when cognition isn't moving along like it should be, we know that a kid's probably not following directions. He's probably not able to kind of keep up with an activity when it's primarily a language activity. And why? Because the words don't make sense to him yet. So we have to really focus with those kids on receptive language. We have to get them to understand what's happening, and we have to teach them how to link meaning and associate. Oh, when I hear the word ball, I know that it's this round toy that I play with, that we bounce and we throw and we kick. They have to know that ball, that's what that word means when they hear it. And so for those kids, we need to spend a lot of our time, especially as early interventionists, helping kids learn language. And again, that means receptively before we expect it expressively. The next little point is tied in, is that a child's receptive language skills are progressing. So when we get a kid who's 2 or 3 or older in speech therapy, and we're saying to their parents, how well do they follow directions? And we see, and the parents most of the time will say, well, they're not. And they'll try to sometimes assign that to other things, like he's stubborn or he's lazy, and we never ever want to do that. We want to think that kids, it's that they can't talk, not that they won't talk. So we don't want to allow parents to continue to perpetrate that myth with their own children. We have to help them understand that late talking is a real skill deficit. It's not that he's choosing not to talk. When that happens, that's called selective mutism. The only way that a kid can choose not to talk like that or whatever is that he or she would have to have normal speech language skills in at least one setting. And that really isn't happening with our little guys who are referred for early intervention services, because their parents would know, well, he talks great at home. This is just when he goes to preschool or when he goes to daycare or when he's anywhere outside our home that he's not going to talk. And so can you see how that's a very different diagnosis? And so you can't really say that our kids that have never said anything, anywhere, anytime, are choosing not to do that. I mean, that's completely different. So they can't talk. So we have to help these kids move along. And again, this third point here with the receptive language, I talked about it a lot back in the cognitive indicator here. It's the same kind of thing. If we have kids who are in speech therapy, after a kid is 15 to 18 months, if he's not really following lots of familiar, simple directions and daily routines, like go get something that's a familiar object, or bring me whatever, if you can't say to him things like, it's time to take a bath, and him know that he needs to run to the bathroom, or you can't say to her, let's go get something to eat, and she knows that she means let's go in the kitchen, that's a real problem cognitively and receptive language wise. They're not linking meaning with those words. And so if a child doesn't understand a lot of language, again, he's not really ready to talk. So we need to think about that, and that would be the primary focus of our therapy, not talking. And that's a big shift for a lot of speech language pathologists to make, especially if you've not worked in early intervention before, or especially if you're brand new and maybe you just kind of missed that in grad school somehow, that even though you are in speech therapy, you're not going to work on talking until we have a child's receptive language and his cognitive skills really just as far as we can bump those up, as at high level as we can get those little skills to where he or she should be functioning for their age. And so that's certainly something that we need to think about as speech language pathologists. And you have to talk with parents about that. You have to say, he's really not ready to talk yet. He doesn't understand very many words. And so we've got to help him understand words. And we know that when we help him understand words, we'll hear more words too. Now, is that to say that there aren't diagnoses where a child, quote unquote, understands everything that he should for his own age and then he's still not talking? Absolutely. But he's never going to get there without that receptive language piece first. And so when a kid has receptive language delays, that's why he's not talking. That's what you need to go with first, is that receptive language / cognitive piece. Work on those things first. All right, the fourth factor, or the fourth prerequisite skill that will let you know that a child is ready to work on words, imitating words as your main focus of speech therapy, is what I just said, imitation. He's able to really repeat what you say. It's really inefficient when we have a child that we are working on and focusing on, quote unquote, speech, just getting the right sounds in the right places, or language, teaching new words. It is horribly inefficient when we try to do that with a kid that cannot imitate pretty easily and pretty frequently. You might spend your whole hour, the whole time you have with a child, on just begging him, pleading him, doing anything you can to try to get him to repeat you. And so see, there's a better way to do it. You don't have to spin your wheels like that, and you don't have to keep keep working at a level that's too high for a child, and that's incredibly frustrating. I know it's frustrating for you as a parent or as a therapist when you've tried and tried and tried and you're just not getting anywhere. So if there is no evidence that a child can watch you and then do what you do, or watch you and then say what you say, he's not ready to work on single words. You've got to back up and work with him at those easier, earlier levels. All right, so now we've talked about that with what prerequisites, unless a kid is doing these things, unless he's interacting, unless his cognitive and receptive language skills are moving along, and unless he can already imitate some actions and some gestures and some little noises that aren't necessarily words, he's not going to be ready to talk. And so, but for the kids who can do these things, let's move on to the next step in this process, which would be guidelines for selecting your first words that you're going to try to get him to imitate. Now, sometimes therapists will just say, or parents, what does it matter? He's got to learn how to say every word at some point, every sound at some point. That's true. But when we have late talkers, what do we know about them? We know that this process is hard. So we have to do everything we can do to control the variables that we can control and make that easier for them. And lots of times it's just in simply picking easier words to say. And I bet you've had this as a speech language pathologist or as a developmental interventionist or whatever you call yourself, or a preschool teacher, whatever profession you are. If you're a professional watching this, I'm sure that you've already tried this. You just introduce any word, or you're just doing what you're talking about, whatever you're talking about, and you're getting nowhere, and then all of a sudden you stumble upon a word and it's like magic. The child just starts to imitate it. And then you start to think, well, I might be onto something here. What made him imitate that? What made that word easier to say? And so that's my point here. We want to think about that with the complexity of the words. And you as a therapist might think, this is such common sense. I can't believe she's repeating this. Well, guess what? I'm repeating it because lots of times we don't think about it. And if you're a therapist thinking about that, you may not be educating your parents that you are working with and talking about these things with parents. So these are the guidelines that you should be sharing with parents and saying, hey, we can't just pick any old word. He's a late talker and this is hard for him, and I know you've already tried a lot of words that he just absolutely cannot say and does not even attempt it. So let's excuse me, let's look at this and see if we can make this a little easier. So your first guideline is you're going to choose high frequency familiar words. Now, why is that important? You want to pick the words that a toddler hears often. And why is that? Because these are the words that matter. These are the words that a child needs to understand first and then be able to imitate. And then once he can imitate, be able to use it, to make requests, to get you to look at something, to comment on something, to answer your question. Those kinds of functions for that word. And we're going to talk about that later. If you're a parent and you're thinking about functions of a word, what is she talking about? We use words in different ways. We can say the word cup to request cup when we want to drink. We can say the word cup to label it when we're just looking at it, or in response if someone says, what's that? Responding would be me saying cup. Commenting or giving an opinion if someone said to me as a child, what are some of your, and again, this might be, I'm just using this for the sake of an example, but commenting or giving an opinion, what do you really like? You look right there. What do you like? What do you want? And again, it might not be the request, but it would be more like giving an opinion, and you could say the word cup in response to that. So you get my point, and we're going to talk about that a little later if that example doesn't make a lot of sense to you now. But my point here is that we need to pick the right words, pick the words that a child needs to use in his everyday routines. Pick things that he loves at the beginning too, because that's going to make him more motivated to want to say those. But especially, again, the words that he hears often, that he should be linking meaning with what those words are so that he can begin to use those words. The next guideline is to choose words that are fairly easy to say. And so we know, again, with late talkers that there's some issue at some level, and we've already kind of gone through some of these things. Is it a cognitive problem? Is it an interactive problem? Is it that he or she just doesn't know how to imitate? And so when we know that there are all these little barriers or roadblocks there, we know that the more complex the word is, meaning it's a hard word like refrigerator or butterfly or gymnastics, or if a kid has a long name like Anastasia or Angelica or Sebastian, we know those words are going to be harder for a kid to say. So we're not going to start out trying to get those words. We're going to make it a lot simpler and a lot easier. And again, that's kind of common sense. Most of the time parents will know that, but sometimes you'll have a parent who will say, I just want her to be able to say, whatever, and you think that's unrealistic. And so that's certainly something we should be able to talk to parents about. All right, the third guideline here is choosing words with sounds and patterns a toddler already uses. All right, so here we're getting pretty technical. So if you're a parent, listen to this whole thing and we'll just kind of walk through it, but I'm going to go ahead and use sort of more technical terminology through this because this is an intermediate level continuing education course for therapists. So I want you to think about this. Now, as a speech language pathologist, you should be doing this instinctively. You should be saying things like, okay, he has one word and it's dada. And so let me think of every functional, okay, so let's go back to our guidelines that we just said. Let me think of every high frequency familiar word that's easy, and that's what I'm going to introduce first to get some success going, because I know he has a much better shot at being able to say a similar word with the initial phoneme the same as opposed to a new kind of phoneme. Now, as an SLP, you can also think, well, if he can say an initial D, what other sounds might he be able to say in the initial position based on what you already know about him, his existing vocabulary? Yeah, you could also choose other kinds of words that start with sounds made at the same place in the mouth. So other initial alveolars, so other words that start with N and with T. And again, if you're a parent or another kind of therapist and you want to make, you want this to make more sense to you, I've done a whole show about toddler articulation. I'll post that below in the comments. I think it's show number 419 or 420, but I sometimes kind of get my shows out of sequence and I didn't include this particular one in my notes. But look for that link there, and it'll walk you through this whole process with talking about how we choose words for late talkers and how we base them on the sounds and the patterns that they can already do. And so for sounds, for me, for youth therapists, think about not only the consonants but also the vowels. So if you have a kid that just has an that's that kind of neutral vowel there, think about some other things. Uh-oh would be an word. Up would be a good word to go with from there. And so you don't have to do this all the time. You really can go more of a semantics, like we said before, that high frequency familiar words, that would be semantics. We're going to look at how those look. And here I really am looking again at more, phonology or phonetics, or however you want to think about it like that. So pick it again from their consonants and from their vowels. And so think about them in terms of word or sound classes, and we already talked about that. If a kid had a D, we would go with other alveolar sounds with T and with N. If a kid has primarily words with, or his three words are all start with M, we'll think, well, let's look at bilabial, so let me look at P's and B's and M's. You might also think, well, let me look at W words, because that's also an early developing consonant sound that's with his lips. That might be where we could go. Maybe that would be a word we could try next, something that starts with that. And so look at that and see what you can determine just by looking at word shapes. Or you might think, well, he doesn't have any consonants. He only has vowels. That's going to be something that you need to say, well, to teach him to imitate, let me just go ahead and focus, word level. Surely you've probably heard some other, with that kind of kid, I would definitely tell you to back up and do some place sounds that had some more consonants in it, and see if you compare, if you can find a word that has his vowel, and see if he, you can pull in, see, can I get an initial consonant, just paired it with his vowel. And so, and you're going to have it make sense, because you're not going to be able just to say to a late talker, probably at this developmental level, say this, say that, and have them repeat it. Now, it's wonderful if you can, and if that's the case, then imitation is not that child's problem. Because that's what we've been talking about in this whole series. But you get my point here. You're going to have it make sense. You'll need to give it some context so that it can have some meaning, and so that a toddler or a preschooler will be more likely to try. And so look at the existing words in a child's vocabulary. Look at the exclamatory words and the play sounds and the words from those verbal routines that he or she have already used. And I hope that if you're sitting there going, well, we haven't done any of that, we're just starting up here at words, I know the problem is words, I hope that that gives you a pause at least, so that you can say, maybe there's a different way that I should be looking at this. Maybe I should go back and listen to some of those other this and see how I can get some of this other easier, earlier imitation going. And that would be my advice to you. If you still don't have a child still doesn't have a lot of sounds, you need to go back and spend some time in those earlier levels. But as I said before, he is going to have to be able to say new sounds, and is going to be able to have to use new patterns. You know, I started talking about this, you know, with a kid that only has vowels. You need to make sure that at least they can use the vowel to do a two-syllable production. So something like uh-oh, where they're changing their vowel, and we haven't added any consonants yet, but we've made that a new pattern. You know, he's sequenced two vowels. And so it's only a huge consideration if a child has a significant suspected childhood apraxia of speech, or you suspect apraxia as a culprit there, that they can't really sequence that, or a severe phonological disorder where the consonants aren't coming in yet, or a severe muscle tone issue where maybe they can't get closure because their tone is so low in their little faces, and so consonants again are going to be hard for them too. So with those kids, even though you're working on language and talking, they probably need an AAC system to get some communication going while you're waiting on their bodies and their little sound systems, even phonologically or linguistically, to go ahead and mature. And so that's beyond the context or the content of this podcast series. We're not really talking about AAC and all those other things, but my point is, if you are struggling to come up with target words for a child and they're really ready to imitate at this level, there's some things that you've probably missed. And so go back and think about those other factors and get some more sounds, get some more things to work with before you are going to focus on having a child try to imitate words. And let me say one more thing. Just because he doesn't have a lot of sounds yet doesn't mean that he can't try to imitate words and omit or substitute some of those consonant sounds. We aren't worried about articulatory accuracy at all at this level. If he substitutes a T sound for a K, who cares at this point? We are just trying to get imitation established, and we can clean up all that artic and all those little weaknesses. We can clean that up as we go. But my point is, you want a child imitating as easily and as early as he can. And even if he's doing sound substitutions, who cares? He's trying. You're not going to be able to, at this point with a late talker, do a lot of things with articulation. You're just going, with correcting per se. You just want to facilitate the emergence of those other sounds. And so when I'm saying, he has to have an initial T to say the word two, when somebody says, how old are you? And he says two, if he's just saying ooh or do for that, or coo instead of choo, a sound substitution, who cares? He's trying, he's marking that sound. You know that it's an error. You'll fix it later. All right, enough about that. Let's move on to talk about more guidelines that we could use for early vocabulary selection. There's a wonderful study done about 10 years ago now with the Child Study Institute at Bryn Mawr College. And they identified the 25 words that every toddler should be using by 2. Now, you can go back and take a look at that study if you want to and look at the criteria. Sometimes when I say this, cynical therapists and parents will have some questions about how do they determine that? What do they just look at this list. And I think it's done by familiarity and use. So how often do these words come up? So, and most of the words on this list too are pretty easy to say. So take a look at your handout. It starts on the second page. of your handout for this course. And so let's take a look at these words. All gone, baby, ball, banana, bath, bye-bye, book, car, cat, cookie, daddy, dog, eye, hat, hi or hello, hot, juice, milk, mommy or mama, more, no, nose, shoe, thank you, and yes. So those were the first 25 words. So if you're a parent and you have ever thought, I wish I had a list, or if you're a therapist and you're not using some kind of little initial word list, this is a good one to use because it's evidence-based practice and you can back up that choice for your selection there. So if we're looking at this purely from just a frequency, and that was our first guideline for choosing target words. This would be a really good evidence-based practice list for you to incorporate as you're sharing information with parents. Now, I've had a list. I've worked for a while. I've been doing this job for a while. And so I have kind of another list that I've just used forever. And so this is what I use. And it's really similar. You'll see some lapses here, some overreach here and some similarities with these lists. And so my functional list or my first targets list always includes common nouns that are specific to the child, because we all know if you've done this job in early intervention and you've particularly worked in a home early intervention program or a state-run program, one of the things that we have in our tools are called IFSPs, Individualized Family Service Plan. And so that means that we are going to try not to use just these cookie cutter recommendations that we make for every child. We're going to really target our interventions based on what a child and his or her family need. And same kind of thought process when we're thinking about selecting vocabulary for a child. If his dog's name, if he is just in love with his family pet and that dog's name is Bo, or something that's pretty easy to say, Boone is my daughter's dog's name. If that dog's name is easy, of course you are going to put that in your early list. I had a kid one time who loved ice. She loved chomping on, sucking on, just having that feeling of ice in her mouth. Would I make that recommendation no, because lots of kids can't handle that oral motor wise, and then you've got a choking hazard going on. But for this little girl, she loved it. So that was one of the target words that she learned how to say pretty quickly. And so think about that, how we can individualize this. And again, put it back in your guidelines. If you say this to a mom, I want you to tell me everything that he loves and all of his favorite, I always try to say, I want to know all of his favorite foods, toys, and people. And sometimes, that would include, their little shows or whatever. And mom gives you a list and all of those words are multisyllabic. You're going to have to back up and do something else easier first. So think about that and talk to parents about that. My next little list with that, beyond common nouns specific to the child, would be lots and lots of all-purpose words. And so let's just run through this list. It's more, eat, milk, all done or all gone, please, go, open, help, and mine. And so when we compare the list between those words that I'm using, there are a couple that are the same. Milk and more and all done or all gone, that's the same. Those three. Eat, let's see, eat's not on the Brand Mar list, but you can go through there and look at that. And I like these words because, again, they're super functional words that we can tie into lots and lots and lots of routines. And I think parents, again, the more quickly we can get them working on other parts of speech beyond nouns. Now, we're going to talk about vocabulary development in a minute, and I don't want to jump too far ahead. But nouns or names of things dominate the vocabularies of all early talkers, whether they talk on time or whether they talk late. And so nouns are pretty easy to teach because they're names of things. We can point to the noun, we can show the noun. And lots of times when we start thinking about other parts of speech or other kinds of words like verbs, which would be action words, or location words, which are prepositions, so words like in, out, on, off, up, down, those kinds of things. Early pronouns, all the versions of me, mine, and my, plus you and I, those come earlier. Those kinds of words, verbs, prepositions, and pronouns, and then even your descriptive words like your adjectives and adverbs. So colors or opposite words like hot and cold, wet and dry, those kinds of words. Those are more abstract because they're harder for a child to conceptualize or even see. And I use this word, well, let's use this example. Let's say, we're teaching this, and this is what? This is paper. We would call this paper with a child. It's easy for a child to see paper, but it's not as easy for a child to really know for shake. And this one might not be the best example because, you can see me shake the paper, but it's just not as easy for a kid to understand that that's really what you're talking about. Or let's say white, the color of this paper. Even though that's descriptive and even though we can see it, it's just not as easy for a toddler to link the meaning with that, especially when they're a late talker. So my point here is I like my word list too because we've got some early verbs in there, and we get parents in the habit of teaching verbs and teaching beyond these nouns, which again, nouns are important. We've got to have those. Those are the most common word class that we see, and we want those, but we've got to help parents learn how to kind of expand that too. So these early verbs on here, and again, all these words, all of them except for milk are pretty general. We can use them for all purpose. We can say more for lots of things. We can say eat for lots of things, every kind of food. We can say all done or all gone, that representing we're finished. We can say that for lots of things. Please, that's such a nice requesting word. Go, we can say go for lots of things. Open, when you start to think about it, go through your day tomorrow or the rest of today thinking how many times you think or do the action of opening. We open books, we open toys, we open packages of food, we open doors. So that's a really wonderful all-purpose verb there too. Help is a great word for asking for assistance, and again, it gets a kid in the habit of asking for what they need and asking for something beyond an object. So it's asking for assistance. Again, that's a different pragmatic function. And then of course mind. Mind is such a great word to teach toddlers because they are all learning that they have individual power, and they are all obsessed with themselves, as they should be, because they're learning I'm different and I'm separate from my mom here. And so mind is just such a great word for independence, which lots of our 2-year-olds, again, that's their little psychological, emotional level of development that they're going through. And so we give them words for that. So I like to think about these words too. And so I wanted to mention those. So are there any words that we would avoid as first targets when we're really looking at trying to help a child be as successful as he can be with imitating at the beginning? Well, we already talked about we don't want words that he or she never hears, and we don't want words that are too hard for a kid to say. But there are also another class of words that parents fixate on that aren't the best for toddlers developmentally, and this doesn't even make sense to some parents why we would say this, but I avoid all academic sounding words at the beginning of treatment, and I'm talking about shapes, colors, letters, and numbers. So why do we avoid those? Because those are non-functional, meaning how many times in the course of a day does a child need to say octagon or blue? They don't, unless you're saying what shape is that or what color is that. And so we have to help parents and they will naturally go to these kinds of words. And if you'll just do a little search on YouTube with the kinds of videos that people are making for babies, they're doing that with shapes, colors, letters, and numbers because that's the kind of information that parents think they need to know. Why? To go to school. And so even if a kid's not talking yet, a parent hasn't made that connection with, they don't need those words yet. We need to teach them more all-purpose words, some more functional words, words they use to function, that we need to teach that first. So I avoid those kinds of words until a child has at least a 50-word vocabulary, and until a child is pulling words from his or her own vocabulary to make their own phrases. Not just imitating phrases, but self-generating and spontaneously using those words. So after we hit about 50 words, then I think about introducing some of those shapes, colors, letters, and numbers, but we don't do it before then. So sometimes we'll get kids on our caseload, though, that those are the only kinds of words that they know. You know, I had a mom one time that I was asking her about a child's vocabulary development, you know, the very beginning of an assessment. And she was telling me, you know, he can count to 10 in Spanish. You know, can I count all of those words? Well, yeah, we can say he knows, you know, uno, dos, tres. We can say that he knows all those words, but if he's not really using those words, you know, what does that really, you know, what does that really matter? You know, those words, that's still kind of echolalic for him. He's not able to use those words. And so have those conversations with parents, and that's actually, it's a pretty big marker for autism, or it's a pretty big marker that mom is over focusing her attention on those kinds of words if a child doesn't know any of those other kinds of words. Usually, though, it's the other. It's that a child that's really attracted to visual information, that's kind of their little preference, and those are the words that they've been able to learn because that's been very, very motivating for them. So would we never use those words if a child already knew them? Absolutely not. We're going to use those words like crazy because that kid already likes it. My point is, we're just not going to teach those words because those are not as relevant. A child doesn't need to be able to use those yet. So think about that. All right, the next kind of thing that I want to talk to you about when you are using or selecting words would be how to teach the words and in what context. And we're going to talk about pragmatic functions in just a minute, and we'll actually talk a lot about that in the next show when we start talking about phrases. But for right now, I've already mentioned it. You know, we teach kids a lot of nouns, and nouns are what late talkers and early talkers and every kind of talker in between learns first. New talkers learn nouns first. So then our natural thing beyond labeling, let's teach a child that they have to do something to get something. So I like to teach words in speech therapy in the context of request, meaning that a child can say that word to ask me for something or ask mom for something, and then he's going to get them. And this is also how we help children who are labelers move on to be word users, not just labelers, and again, labeling is a pragmatic request. I mean, it is one of those functions of speech, and it's one of the earliest ones to come in, but you can't just have a child stay there. And you'll probably see that, and this is a marker, again, for high functioning autism, you know, at the toddler level, where we're thinking, well, he can already say 200 words, and I've had this happen with kids, and we'll see a little girl. I don't think she's in this course today, but especially my autism course that I'm about to release as a podcast series, we'll see a little girl like this, that she had a couple of hundred words already, and when her mom called early intervention to say, well, you know, the problem isn't that my kid can't talk. She can talk. She knows a couple hundred words, but nothing really makes sense. She can only name things, and it's really frustrating. I know there's something going on with her developmentally, but because she knew so many words, she didn't even qualify. She didn't get past that stages and ages questionnaire that they used to kind of screen kids over the phone. And so we have to look at this. And so if you're an SLP and you've been working with a kid, or an OT or a PT, working with a kid and they have lots of words, but there's still some other markers for autism, and you think, oh, I don't need to be worried about this kid because language is coming in. Not so fast. We've got to get some other things going too. And so let's talk about just some red flags right now for high functioning autism in toddlers, because a lot of times, again, parents are thinking they're desperate for strategies, and they're probably beyond this point because they probably have taught their child how to imitate words already, and that's a learning strength for those kids, you know, those echolalic kids. They can imitate, they just can't use. So let me tell you some red flags here so you'll know if that's what you're dealing with. These are the kids that can talk but not communicate. Again, they may label hundreds of nouns. You know, mom may have an app on her phone where they just go through word after word. It might be a parent who still uses flashcards. It might be a family that they have lots of electronic toys that label. So you push the button and it says bear, and then you push the next button and it says cat, and a kid is kind of obsessed with that, but they've learned those words. And again, is that a bad thing? No. They can talk and they are labeling, but for those kids, you know, it's the communication piece that's off. And so I just wanted to talk about that and how that's why it's so important to teach words, not only in the context of labeling, what's that, you know, find this, show me that, you know, whatever you're doing with that, even receptively, we've got to have kids be able to use them. And so asking for things, making these requests, that is your best way in so that a child understands, oh yeah, I've got to use this word. I've got to do something to get something. And it's not always with words. Kids can do it with gestures or with sign language, or if it's an AAC device, they can do it with a picture or a speech generating device like a Big Mac or a GoTalk or whatever you're using. But at the same time, they've got to learn that, and they need to learn that pretty quickly. So if you have a kid here that you're working on imitating, go ahead and put it in the context of requesting. So again, they get that nice, they establish that nice back and forth, and they establish, hey, I've got to really use my words here. All right, so let's move on and talk about materials. What are the best things for teaching a late talker new words? Toddlers, all of them, whether they talk early or whether they talk late, or like I said before, anywhere in between, toddlers learn best by doing. So you want to try to keep your activities as real life, meaning that we're going to have the toy we're taught for the words that we're learning about. We're going to use something here or some activity versus an app or flashcards or any kind of, like we talked about before, electronic toy. Now, our kids who love those activities seem to need them the least. Some of our little friends, again, with autism are so attracted to and drawn to and hooked in by screens that you disappear anytime that you try to introduce an activity like that. And so, I mean, I'll just tell you straight up, I don't use apps in speech therapy because I want a child to learn to communicate with people. And we know from research that children learn best from people, not from apps, not from a YouTube video, not from putting them in front of even a wonderful television program that has tons of research to back it up, like Sesame Street or any other thing you would see on PBS. They just learn better from people. And the kids who are so attracted to screens, again, you think they're learning because their little eyes are focused on the light and they're sitting still and they're watching. But cognitively, they can't process all that, especially with the garbage that some of these children's programs and even apps do. The pictures switch way too frequently. A kid barely has time to process visually what's on there, much less kind of put a word on it, and especially if they're not using any language at all. And so sometimes the kids are just, they look like they're enjoying that because they're just so magnetized by what they're seeing there. And again, language really is an auditory system, what they hear, and then what a verbal system, what they say. And so when we make it about a screen, we leave those all important pieces out. And yes, they may be hearing some things, and I'm not slamming all of that. I'm just saying that if we want to do what research tells us works best to teach children to talk, we need to stick to real life activities. So toys and daily routines. So our first thing with selecting materials is that it needs to be something that a kid likes and something that you can do a lot with, something that he's going to want to stay with you for a while and play. And I've said this before, and I'll say it again here in this show in case this is one of the first times that you've heard me talk or the first time you've seen some of my work, but with late talking toddlers, our very first thing that we want to do with kids is know we're going to have to play. And then we're going to have to play some more. And we're going to have to play some more. And what I like to say is we're going to have to play and play and play and play and play. And we're sick of all that. We're going to have to play some more because that is how kids learn. And so we have to just kind of know that from the get-go. We have to do a lot of repetition, a lot of presentations of the same material over and over and over so that we can give them enough repetition to learn and to practice. And they have to practice understanding this word and then saying this word enough so that they will be able to use it. So we've got to pick materials that they really like. Let's take another little side trail again to talk about autism here. When we're talking about picking materials a kid likes, sometimes with our little guys who are on the spectrum, we can't pick things they love. They're kind of obsessed with it. So we don't want to do that where the material that we're using actually causes us more, it's more trouble than it's worth, where the kid's going to fight you with it the whole time and all he wants to do is kind of be obsessed with it and hunker down on it and keep it from you. Don't do that, but pick things that are fun and pick things that they like. And if you need some ideas for that, my goodness, my whole website at Teach Me to Talk is full of ideas for that. Or scroll down here on YouTube and look at some of my Therapy Tip of the Week videos where I'm showing you toys and showing you how to use those toys. Those are the kinds of things that we can use to help a late talker learn to use new words. Other things like everyday routines that they love. So if a kid loves bath time, use it. If a kid loves playing outside with mom and dad in the backyard, use it. Because we know those are the times that he's going to be most connected, most attentive, and most ready to learn. Also, when we are looking at how to cue and facilitate single words, we want to find a balance between being fun, which I've done a lot of talking about, how playful we have to be and how exciting we have to be, and especially back in our previous shows, we were talking about verbal routines and play sounds and exclamatory words. You can't model those kinds of words and teach those kinds of words if you are a bump on a log. You have got to be exciting and be fun. And a kid, again, has to want to be with you and stay with you. But you've also got to balance being a little bit demanding, meaning that, especially at this level, when a kid is developmentally here, we've got to help a late talker get over that hump. So we have to have some strategies that pretty much let them know it's time to talk. And we're not going to be authoritative about it. We're not going to have power struggles because nobody wins power struggles. But at the same time, we're going to expect them to talk and we're going to expect them to imitate. And so that's a tricky balance because some of us go too far the other way where we're really mean, holding a sippy cup and saying, you can't have this sippy cup until you say cup. You can't do it that way. But you certainly got to set it up where it's more likely than not that the kid is going to try to imitate what you say. The other thing we want to do here is be sure we can do everything to achieve early success. So what does that mean? That means, again, that we're going to use the guidelines that we talked about. We're going to pick really good words that are high frequency, pretty easy to say, and likely using a pattern or a sound that a child can already use. And we're going to pick words that, again, are not multisyllabic. We already talked about that. And we're going to pick things that a kid likes. So when we put these things in place, it's less likely we're going to mess up and do something that would, again, make a kid run away from us and make a kid not to want to be with us. And again, we're going to be fun, we're going to be demanding, but we're not going to be authoritative. Another thing we need to do here is master withholding. So what do I mean by withholding? I gave you a bad example a minute ago when I said, you're going to have to say cup before mommy gives you this sippy cup. You're not going to be like that, but you are going to withhold a little bit. And you aren't going to just give a kid every single thing he wants when he's a late talker because he's got to have practice and he's got to learn how to ask for things. And so I like to use my 3 to 5 time rule, meaning I will model the word 3 to 5 times, meaning I'm going to say it at least 3 times, but no more than 5 times, to give him an opportunity to imitate. And then if he doesn't imitate, I have 2 choices. If it's early in this process and if a kid is prone to kind of fall apart and I know that I am making him mad and likely driving him away from me, I'm going to go ahead and give it to him after that 3 to 5 times, because again, I want to keep him with me. And so even if I give him that one little bite of cookie, I'm not giving him the whole cookie, I'm breaking that cookie up. If I give him one little bite of cookie and then he gets it, we're going to immediately try again. And I'm going to start over with that whole modeling process. So let me just kind of run through that with you. And you'll see some of this in the video clips. We've got a lot of video clips in this course left to watch. You'll see some of these things, but I'm asking a child, let's say that we're using cookie, and I would be, holding it up and saying, cookie, cookie, you want that cookie? Gotta say it, cookie. You say cookie. And so see, that's 5 times. And I, of course, would have paused during there to give a child a time to respond. You saw my face there with my expectant waiting that we talked a lot about back in verbal routines, and we'll talk about that here again. Where it's my tell me face, where I'm leaning forward and I'm making my face look fun and my eyes are wide and my mouth is maybe open and I'm, again, it's all anticipatory body language, like it's your turn to talk. And so we put that in and we go slower than I did then, with a real kid. But my point is here with withholding, we're going to say the word that we want him to say at least 3 times, but probably no more than 5 times before we give him the cookie. Why don't we go past 5 times? Because does it really help a lot of kids, if they have to hear that word the 32, 57 times, they're not going to say it. That 3 to 5 times is kind of that sweet spot. Now, I have looked for the evidence-based practice reference on this forever, but I first heard this back with a presentation with Tamara Casper and Nancy Kaufman when they were talking about kids with autism who are also apraxic and kids who start to sign. And so Tamara Casper is an ABA person and a big signer. And so she was talking about, what do you do if you've prompted that sign or cued that sign after 3 to 5 times, what do you do? She said, I just give it to him anyway. I'm not going to fight with the kid. And then we can start over because they're still happy. And that makes a lot of sense to me. So teach parents that rule, that 3 to 5 time withholding rule. Another strategy that's really helpful here at the single word level might be something you think about using with younger children, but it's using mother ease or parent ease. Now, what do I mean by that? It's how we talk to babies. And researchers coined that term for that melodic little baby talk that we use with infants. Now, I'm not saying that we're going to do goo goo gaga, that kind of thing. No, I'm just saying we're going to add some prosody, or we're going to add some intonation that will make what the word that we're saying sound heightened and help a kid kind of pull that out of all the other words he's hearing that he or she may not understand yet. And this is really, really important for kids who are in this earliest level of trying to produce words. And so let's use our example, cookie, instead of saying cookie. Want a cookie? Cookie. You're not going to say that. Try something more like cookie, cookie, cookie. And again, making it just as melodic and prosodic as rhythmic as you can with that. Do you want a kid talking like that when he's 7 or 8? No, but you do want children really alerting to that and really attempting to imitate you. And so that works pretty well with a lot of toddlers. And again, for some of our little guys, they still aren't too far off that infancy phase, where we know researchers have proven that mother ease or parent ease, if you don't want to be discriminatory there against dads, that works better to help infants tune into language. And so we certainly need to take advantage of that, because we know that there are differences in a late talker's auditory system, not just their verbal, but there's some differences probably in their auditory system too. If you want to hear more about that, I did a show, All You Want to Know About Late Talking. I believe that's show 421. So go back and listen to that course, because that'll really give you some idea of why this really is evidence-based practice, because those little auditory systems are different in our little late talking friends. So that's something we can do to get a late talker really trying and attempting more, is encourage their little listening systems, and then that makes it easier for them to imitate. All right, so now we're ready to talk about some therapy clips, and so I'll be introducing the remainder of the strategies that we use with late talking toddlers, and really demonstrate them to you and illustrate them to you as we talk about these strategies as you watch these clips. Okay, so this next strategy that we're going to talk about is called vocal contagion. And so we talked about this back in the previous show 427, when we were talking about tips, and 426 when we were talking about tips that we could use to help a child become more noisy. And we know that a kid has to make noise before he or she begins to talk. I mean, that's a no-brainer, right? You know, if we weren't noisy, we would not be able to produce these words. You know, we learn it easier, earlier ways. And so we have to get kids noisy first. Sometimes when we're at this single word level, we will see kids too also kind of struggle to get it going. And at the beginning of a session, it's kind of hard. It might take 10 or 15 minutes with a late talker before they say anything. And so we have to figure out ways to get that going sooner. And vocal contagion, or crowd noise, is something that we talked about, again, back with getting any kind of noise going and verbal routines going, that's how we, you know, again, prime that little pump and get kids going. So watch this video clip of my little friend, and we are using the premise that we're going to get everybody in the room involved here, and we're all going to talk, and we're all going to make noise, and see if that makes it easier for this little girl to imitate this word. And in this clip, my daughter's in this clip, and she's now older. She's now a speech language pathologist on her own, and so you'll see how we used her here in this session with this child as the model too. And I modeled it, the little girl's mom modeled the word, and my daughter is there doing it too. So watch how vocal contagion is supposed to work.
What's next, Elsa?
Nose.
That's so good. Say it. Tell me. Nose. Nose. There it is. Nose. Nose. Where's it go? In. Nose. In. In. Turn, 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 turn. Boy, he's gonna sneeze. Chew. Sneeze with his nose. Chew. What's next? Are we gonna get teeth or toes? Which one do you want? You tell me. Teeth. Teeth. Good. You say it. Teeth. Mommy said it. Let's see if Macy can say it. Macy. Hey, Elsa, can Macy say it? Macy said teeth. 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 Did you hear her say teeth? See, and I think if she could imitate,
Yes, she would. I know.
and you want to keep getting
She said it. She finally said nose, right? And if you watch the previous course in this series, you'll remember that little girl's history. That mom came to see me because she bought the treatment manual, Building Verbal Imitation Skills in Toddlers, and she emailed me and said, my child is stuck at level 6 at verbal routines. I need to get her over the hump to do single words. And so that's kind of where we were. And so it was so exciting. I hope you noticed that mom's face. She was just thrilled that she finally was able to imitate a little word like that. And so we see that as therapists a lot. We'll hear that, and that's one of my favorite parts about this job, is that we get to participate in those little moments. But I hope that you'll see how we use vocal contagion. It wasn't just that I said it, and it wasn't just that Mom said it. We got everybody to say it there, and that helps for lots of kids. All right, the next principle that we want to talk about is called mass practice. And this is what we have to do with new talkers. It's so that we can make their words not just happen every once in a while, just a word that they happen to pop out. We've got to make these words really consistent. So how do we do that? We do it like we do everything else. If we want to get better at playing a musical instrument, what do? We practice. If we want to get better at a sport, what do? We practice. And so we have to do the same thing with talking. So repetition at this level is critical. And if you are the kind of therapist that you can get a word 1 time or 2 times in a session and you're fine, and then you wonder, why isn't he saying that again? 2 weeks ago, he said 3 different words for me, and Mom hasn't heard those again, and I haven't heard those again. What's going on? Why is he so stubborn? It's not that. It's that he didn't have enough time to really master that word. And so you've got to set that up in therapy, and you've got to teach your parents this. You've got to say, hey, when you get a new word, don't just celebrate and then go do something else. Your work has only started. You've got to get that kid to say it over and over and over and over. And so if we think about this, in terms of, well, let's use this neurological example that we use for apraxia or for motor planning. We know that when we talk as adults, our pathways from our language center in our brain, let's get on the left side over here, from our language center in the brain, Broca's area, we know that we've got to send that little message to our mouths, right? And again, this is a real simplified way of talking about it, but it makes sense. And so that word, because we can say that word automatically and easily, that has become a superhighway, and I shouldn't have done my hand like the wave. I should have done it straight. It is a fast path from brain to our mouth. We can say it. It's easy. When kids are late talkers, particularly when they've had motor planning problems, and again, we refer to that as apraxia, when they have that difficulty, that word to get from their brain, their language center, to their little mouth is not a superhighway that's flat and efficient and fast. It's more like a bike path with hills and grass and bumps, and that path only smooths out to become a highway with practice. So that's what we have to do as the adults, as the therapist or as the parent, or really as both. We've got to give kids enough practice so that we make those words more automatic and more efficient. And so that's what we have to do. We have to set up these therapy activities where we get lots of repetitions of the words over and over and over and over and over and over again, so that a child has enough time to remember the word and to imitate it and then be able to use it. So here's my little friend. We saw him back in earlier shows in this process too, and here we are. The first time that you saw him, he was learning how to sign. Do you remember that back in show, I guess it's 424, where we're talking about imitating body movements and communicative gestures, and I showed you the clip of when he came to see me in my clinic first, and then his mom was frustrated because he didn't hold on to the sign, and then tell a story about weeks and weeks later how she got him to use that sign again. So this is a subsequent visit where he came back like 6 months or so later. So he's older and he's just now learning how to imitate words. And his mom was saying, you know, he really likes balls, and he's popped it out a time or two, but he doesn't really say it with any consistency. So I thought, well, here's my goal for the day. So let's watch this little therapy clip with me, with Elijah, and just count how many times and how many opportunities. Not only do you hear me say ball, but how many times that I want him to say it too. And we'll talk about another thing about modeling. We'll talk about that after this clip, but watch this clip first.
Here. Give me the ball. Ball. Put it in. Ball. Oh, do you want them to match? Ball. Yeah, match. Ball. Yay! I got it. Can you do it? Bang. No, I want to put them in where they go. Ball. Oh, more. That was good. Say ball. Love it. Ball. Good. Look at it. Oh, you just like pushing it. Yay! I got it. Ball. Good. Ball. Good. Ball. And what he can say when he'll be better than add new stuff.
Okay.
Ball. Good. 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 Listen, this time get hammer. Hammer. Good. Hammer. You say it like Laura. Hammer. Hammer. Do your almost. Hammer. I'll take it. Here. Does your mommy not let you have the hammer? Or do you just like to push it?
Yeah, I've tried.
Yeah.
Afterwards,
Yeah.
it's like hand over hand.
Yeah. What do you want? More. Good. Say ball. Good. 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 Yay, Elijah.
How about that? That was pretty good, right? And I hope that you took my advice and listened for not only how many times I cued him to say the word and he said it, or did you also listen for how many times I modeled the word? And that's very, very intentional. Dr. Caroline Bowen is a speech pathologist from Australia who's done a lot of work with late talkers, and she says that the recommendation is that the adult model the target word 12 to 18 times. Now, I don't know about you, but that seems like a whole lot to me. And so that's what I really tried to do. Once I read that research, and again, this was years and years and years ago for me, I started keeping data on myself. And anytime that I have a kid that's not really talking, and I have no data to keep on him, that's what I do. Or I even will encourage moms to do this and say, right now he's not saying it, and we're not getting that word like we want, as quickly as we want. But our job right here is to make sure that we model it enough. And so do that this week. Keep data on yourself as a therapist. How many times are you modeling that target word? Another thing that we need to think about here is not having too many target words per activity. So at the beginning, we just have one word. That's our goal for that activity. So for Elijah then, our target word was just ball. I mean, sometimes as therapists, we think, I'm just going to do language stimulation, language stimulation, language stimulation, and we'll end up with that kind of toy. We might have said ball and in and hammer and bang and out and yay, and we could have had, 15 target words, but we don't want to do that. We want to simplify so that we can get that mass practice. And remember, that was the strategy that we're supposed to talk about with this therapy clip. It's that we have one target word and we practice over and over and over and over. And again, that's for mastery. Now, with that, your toys will make a huge difference with that. And so the ball and hammer toy is enough, kind of woohoo to keep a kid's attention right there. But sometimes you're going to really need to think about that I'm going to have multiple activities to work on this one target word, because I just can't keep him with me long enough for him to really master that word and get enough practice with that. So if you're working on car with a racetrack, you might have 10 little matchbox cars, and you give that child that car one after another. He has to always ask for it. Use the same principle with withholding that you just saw me use there with Elijah. That same kind of where you're withholding it, you're going to give him the 3 to 5 time models. Hopefully he'll say it, every little with 1 3 to 5 time is just one trial there. As a therapist, you understand that, but a parent may not. And so you think about that, and you think, how can I set this up with cookies or some kind of snack? That's a great way to practice. Bubbles, great way to practice, because your turns are really, really fast. And so think about your materials that you're using there and your target words so that you can be sure that you're getting enough mass practice here. Now I want to show you one of the best strategies or best activities that I've ever found to get mass practice with a single target word for toddlers. Now, this is what I call Muffin Pan Therapy. I learned it from another therapist a long time ago, and honestly, I thought it was the dumbest idea I had ever heard at the beginning, but I want you to see how well it works. And why does it work? It's because toddlers like to put things in other things. We know that's kind of a developmental process that they're working through, not only cognitively, but motorically, to get the little object in the little hole. And they also like, again, the repetitiveness of it. So the Muffin Pan kind of sets it up where you're going to have 12 opportunities for the child to say a word. So listen to me explain this to the mom, and again, watch how well a child can do. And you can set it up a couple different ways. You can do it like a verbal routine where you are saying, then let's say that your target here is, let's say that your target is B, and you're going to do little bumblebees, little toys or little foam pieces or whatever you've gotten from the Dollar Tree or whatever. And so you want the child to say B every time you put it in the hole. And we'll think about that we have 3 rows and 4 lines on our muffin pan here. And so if you have a kid that can't do all 12 yet, what could you do? You could set it up like a verbal routine where you put the B in and you're saying B, 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 and you're waiting for them to say B to put that last little bumblebee in that last little hole. Or you could use anything for this. And I have just collected bags and bags and bags of sets of 12 tiny objects. You can do cars. You can do army guys. I either call them men or guy, depending on which consonant a child is using. If they're using a pharyngeal consonant, we'll use guy there, or a bilabial, we're going to use, man for the M. Or just anything where we can have the same word. You might get all 12 little plastic dogs, and dog is your target there. It doesn't matter. Let your imagination run wild. Go to the dollar store or Walmart and pick up, or raid your own toy inventory and pick up just little sets of these. Watch how to use this. I'm explaining this to a mom so you'll understand more as you see it happen, but know that you can use this a lot of different ways, but it's so effective with toddlers, and I want you to see it.
Bow. You want to bow? I love it. Can you put your bow in? Oh, it sounds like blow. It does sound like that. Bow. Bow. Good. You're going to tell me bow. Bow. You tell our bow. Good try. Bow. I love it. Isn't this just the dumbest idea? But it really is. Yes. I love this. Yay, 2D. Good. That's right. Good. Let's say bow. Bow. Good try, Elsa. I love it. You can tell me bow. Bow. Good. That was closer. One more time, bow. Bow. Wow. That was good. One more time, tell me bow. Bow.
By now, if you've done a good job selecting your target word, and if you've done a good job selecting your materials, you should be getting an attempt at imitation nearly every time you cue a word with kids. If not, if you are still really struggling, and if it's not just at the beginning, like back with my little friend Elsa, getting her to say the word nose in Potato Heads, and the clip that we just saw with her with the Muffin Pan with Bo. At the beginning, you're still going to struggle because you've got to get a kid there with you and ready. But after you've done this for several weeks, if you're still not getting anything, I want to tell you that kid is not ready. So you've got to do some more analysis so that you can think, what have we missed? Now, lots of times it's just going to be that you're just too far up the continuum. You're still up here at level 7 when, I've been preaching to you this whole podcast series about how we've got to work back here at these easier early levels of imitation. And so if this is, excuse me, the first time that you've heard this kind of method that you can't start with words, please go back and listen to some of those other shows. You've got to get kids working up that level. And I showed you the graphic. I guess it would be this way with the graphic, where we start with level 1 with imitating those actions, and then level 2 we're imitating body movements, and then we do some face movement without sound, and then we add some sound but still not at words, and then we make the words highly tied to context with verbal routines, and then we do functional words. So you may have jumped the gun, and you probably need to back back up and work on some of those easier, earlier levels. And how do I know to tell you to do this? Because I've made that mistake. For years and years, I would think there's got to be a better way to do this. And this method certainly would do that. The other factors that you have to think about, it might be that you've jumped the gun so much that, like we talked about before, it could be a kid's social skills. He's not connected enough with you to imitate the words that you say. He's not watching you. He could really, couldn't care less that you are trying to get him to imitate a word, because you've jumped the gun, like we said before, with his social engagement. He's just not there yet. So you've got to really, really get him connected to you first and move through these other levels of imitation. It could be that cognitively, again, he's not linking meaning with those your words yet. He doesn't really even understand how to imitate yet with this little body. So you've got to back up and work on that first. It could be sensory processing, that he's still too busy. And we talked about in the last show with verbal routines that we would use a move, sit philosophy. We can move around. I can chase you. We can do lots of gross motor things where we're jumping and we're running and we're swinging in a blanket or swinging on the swing, or you're going down the slide, or any little thing that we've come up with to do in your house, where we get your little body in that best position to be regulated, or just, that calm down, just right place for listening and learning. And so if we don't have a kid there, we think, well, no wonder he's not imitating this yet, because he's still chaotic. He's not pulled together and regulated and organized yet. And so that might be what we have to pay attention to. It could be, like we said, a receptive language problem. He doesn't understand that word. You're trying to get him to say a word that he hasn't really linked that meaning. Now, some kids do have to say the word before they seem to understand it, but that's where the beauty of this system for teaching imitation comes in. When you have a kid like that, that's what you're doing. You're teaching him to repeat the word, and so you're helping him link meaning, but that's kind of an outlier. Most of the time, toddlers understand many, 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 many words than they can say. And so that's with typical development there. And so again, that may be a real gap. He's got to understand that word before he's going to be able to really say that word and use that word. So it could be a receptive language problem. And again, it could be the whole dreaded, it's you as the adult. And that is sometimes so hard for us to recognize as parents and as therapists, as, gosh, I have been doing this all wrong. He is going to do better. Yes, there's a problem, because if there weren't a problem, it'd be typically developing and this would be moving along and yada, yada, yada. There is a problem with the child. But sometimes it is that the child has sort of a mild to a moderate problem, and then we change our strategies and everything comes together. And so I hope that I've given you a lot of tips, not only in this show for helping a child learn how to imitate, but in the previous show. So you've got to analyze the factors. If you have listened to this course and you start to do this and you realize in 2 or 3 weeks this is not happening, I just beg you to do things differently and not just keep on doing the same old thing. Or if that's been happening with you, you've got some kids on your caseload that they're just not making any progress, analyze these other factors that are contributing. It's probably that the child's not developmentally ready to do a lot of imitating, and that's your job to get him there. And so in a sense, it really isn't the kid, it's you. And so you've got to change what you're doing to make it better and make it more successful. All right, so what do we do now? What do we do now that when we have a kid imitating lots of single words? Don't leave him there. Bump it up. And so I want to take a few minutes to introduce you to some other strategies that are so effective for new talkers to take their words. We still give them an opportunity to imitate, but now we want to help them move to use these words spontaneously or on their own. So let's talk about some strategies we can use. The first one is choices. Now, choices are fantastic because they give a toddler the illusion of control. They think that whatever you are having them pick, again, they rule the world, that they get to choose. And that's wonderful. And we need to take advantage of that as therapists and as parents with really offering choices. Now, I don't want you to offer one choice. I want you to have dozens of choices, even within a single activity, and hundreds of choices for a child in a day who's a new imitator. And why is that? Because the more frequently he can imitate a word, remember what we said about the superhighway? The flatter that path is going to be, the more efficient it's going to be, and he's going to learn how to talk that way. You're just giving him enough practice so that he can get mastery. And so choices turn a child into a full-time imitator. And when we get kids to full-time imitators, they become talkers pretty quickly. And so I love choices here. It can also kind of trick a toddler into talking when they have been a kid that's maybe more reserved and who, again, for whom talking is harder. You start to give them some choices and they want to participate, and they get to choose. But remember, keep it super fun, keep it super light, and keep it super motivating. I mean, don't offer something for a choice that a kid isn't going to want. And I should have said that with requesting too. And that's why we always use materials and things that a kid really likes. And so here, what we want to do is just use as many choices as possible. I'm going to show you a therapy clip of that with me with a little friend, and count how many different choices I offer her as we're playing with this farm set. It's not just that I say, you want to play farm, and she says yes or no, and that's it. I'm offering a choice at every opportunity that I can. So watch this. Very good. Open. I know. Which one did you want? Do you want the horse or the cow? Horsey, please. Very good. What's your horsey gonna do? Is he gonna go night-night or drink water?
No.
Which one? Go night-night or drink water?
Night-night.
Oh, good. Night-night, horsey. Look, is he gonna go night-night down here or night-night in bed? Where? Oh, do you mean that bed? That's what you'd have to say. That bed. That bed. Good job. There he goes. Oh, what are you going to say to him? Rory, what will you say? Oh, you want it on? What do we do? Where is it? Is it on the bottom or the top? Bottom. Good. Oh, who's going to turn it on? You or me?
Mom.
Say me.
Me.
Uh-oh, push. Look, are we going to push up or push down?
Yeah.
Good. Say it again. Push down. Good job. There we go. All right. Uh-oh. What are you going to push now? You push the nest or push the bed? Oh, that one. What's that? What did you hear? Was it a sheep or a pig? Listen. Oh, my goodness. What was that? Was that a sheep or a pig? Listen. Which one was it? Listen. Uh-oh. Rory, what is it? Oh, my goodness. Was that a baby pig or a baby sheep? Which one? You can't tell me because you have chip in your mouth and hair. Look, listen again. What is it? Was it pig or sheep? It's sheep. It was a sheep. You want to hold that sheep, I know. I hear him. What's that sheep gonna do? Look, does he want to eat or drink? Oh, did you say it? Say eat. Oh, I hear him. Which one is he gonna do? Drink water or eat some hay? Water. Okay, make him drink some water. Oh, he's falling in there. Help! Rory, what's he doing now? Was he going to drink or take a bath? Bath. Help him wash. Yay! We washed that sheep. That was funny. What's he going to do now? Stay in or jump out? Oh, over here? Look, this mud or that mud? Which one?
Open.
Oh, open? Okay, here he comes. Is he going to stay down or go up? Oh, you didn't say it. Down or up? Good. Put him up. Oh, oink, oink, oink. I heard a pig. There goes sheep. Oh, what's he going to do? Is he going to stay or slide?
Slide.
Tell him slide down.
So cute.
What's he going to do? What's he going to do? Is he going to slide down or stay in?
Cute.
What's he going to do? I think he should slide down. You say slide down. Here he comes. Oh, oh, oh no, sheep. Oh. Now let me give you some tips to move those imitated words into something that's more spontaneous. And for this, we use a strategy called environmental sabotage. And in case that sounds a little mean to you, what I'm really saying is that let's use the other word, communication temptations. It's that we want to tempt a child to communicate. We want to make it so likely that he will say the word. You know, we just want to do everything we can to set that situation up. So what do? We use materials that really set the stage for that. And we've already sort of talked about this when we said if we were going to use a racetrack, we would want to have 10 cars so that we could hold the cars. And every time he wanted a car, he had to say car before he got it. So now we're going to bump it up and make it a little harder, and we're really going to set up situations where we don't give a child everything he needs for the activity that we're doing so that he will try to ask for it. And this can't happen with a kid who isn't using a lot of words and who isn't. If a kid isn't imitating words, you cannot use environmental sabotage. You've got to go back and use withholding to get him to imitate and use the choices to make it really, really fast and frequent and easier for that kid. And so when we get to sabotage, we will still model the word a little bit, but we're helping them, especially at the beginning of the activity, but we're helping them learn how to retrieve those words because we're going to give them a structured activity and then use those words on their own. And so we're going to use toys that promote a lot of requesting, and we might just kind of sit and wait for a kid to use the word, and we might have gotten them going at the beginning with saying, let's pretend we're using bubbles. And so I've got my bubble container and I've got my wand and I've, blown bubbles and said, bubbles, bubbles, oh, bubbles, yay, bubbles. And I've said bubbles a lot. And then I put the wand back in and I say, you want some bubbles? Bubbles? Tell me bubbles. And they say bubbles, and then we blow, and I might do that a time or two, and then I'm going to put it in, and I'm just going to wait. I'm going to see what that child's going to say next. And so hopefully he'll pop out bubbles, and we'll move on, and we'll get that going. So I forgot to talk about this back in withholding. So let me say this. I think I started this in withholding. I said you've got two things. You can either give them what they want after that 3 to 5 times of you prompting it, and even if they don't say it, you can go ahead and give it to them because you want to keep them with you and trying. Or you can back up to an easier word, or even if you want to take it way back, you could even maybe back up to a sign that they could use, or maybe even something that's their default word. So they're still doing something to get something, even if they can't say bubble. If they could say to you more or please, go ahead and blow the bubbles, because they are vocalizing, they're verbalizing, they're asking you for that using a word. You've just made it simpler. So that's what we can do when withholding is too hard and when a kid's getting too frustrated. Back it down and use an easier word that he can say, and then move it back up to this harder word. But now let's move back to talking about sabotage here. So what we want to do here again is do everything we can to set up the situation for them to talk. So this is something I do in sessions a lot, and I did it a lot when I saw kids for home visits, is when other siblings were there, everybody just sat in a circle. Maybe there's a brother or sister or two and the kid that I'm working with and the mom. And so I would get the child's favorite snack, and we would put the kid at the end of the line. And so I would, ask his brother or sister, what do you want? You want a chip? Say chip, and they're going to say chip. And then same thing to the sister, same thing to mom. Oh, what do you want? Oh, look, what's that? Tell me chip. And then they say chip. And then you get to the kid that you're working with. And so, again, have you really sabotaged when you're doing this? Not really, unless you're not going to give him the chip, but you've really set it up. So he's seen everybody ask for the chip. And then it's his turn to ask for the chip. And again, you can do withholding there where you do it 3 to 5 times and give it to him anyway. Now, if you have a kid that's not going to fall apart, you might skip them if they're not going to say it. But most of the time, you might just go ahead and give it to them and then start that whole process again. And then after you've done this for a while and you've done this sort of thing, you don't even have to say what the target word is. The kid just kind of knows. Oh, and that's where you're kind of really sabotaging, is you're sitting and you're holding those snacks until they ask for that snack, and using the brother or sister or friend, or if you're seeing kids in a daycare setting, that might be something that you can set up and do. But you're not going to give them that snack. I've had kids that I've seen one-on-one that I've just, say they like M&Ms, I'll just sit and put one M&M in my mouth and just kind of look at them while I'm eating it, and even do oh, this candy, oh, it's so good, it's so good. And then just wait to see if they're going to say candy or please, or even back up to their little sign. So those kinds of sabotage situations can be so fun and so effective, but only if a kid is a good imitator already, meaning that you might still have to give him the word, especially at the beginning of the activity. After you've had 3 or 4 M&Ms, you can kind of wait him out a little bit. But he's also got to be able to tolerate that just from frustration tolerance standpoint, meaning that it's not going to make him too mad. But you can set it up like that, where he starts out the task imitating the word, and then it becomes more spontaneous. So anything that you can do here to set up that sabotage with toys, how I like to do it, and again, this is when a kid has already imitated pretty well, I'll just set up part of the activity and then not give them all they need. So if it's a racetrack, I'll set the racetrack up and say, oh, we're gonna play. Let's play with this racetrack. Oh my goodness, look, I see the track. But what's missing? What do we need? And you can just sit there and not say anything, or you can do that little scenario where you prep them a little bit, and so they have to come up with car, where's the car? And they're not going to say that whole sentence, but hopefully, and you might even, pull the car out and go, oh my goodness, oh, look what I have, oh, and if they don't pop out car, just say, it's a car. Do you want it? Your turn. And then they have to say car. So let me give you some examples of how we could do that. I've walked you through the process. At the beginning, you could just kind of wait to see if they say it. If they don't say the target word, and you haven't provided it, maybe you could show them the next toy that they need. We can play dumb for so long, but sometimes kids do need that visual cue where they come up with it. And then if they don't say it, go ahead and model what the target is so they can at least imitate it. But you could do the racetrack with no cars. You could set out a puzzle and you're holding all the pieces so that they have to ask you for the piece. And again, if they don't know all the pieces in the puzzle, you could hold up 2 and you're back to choices at that point, or you could just hold up the 1 for sabotage, and just kind of twist it and do everything you can to make it fun so that they can see it, and then they ask. And remember, if they can't say it, what are you going to do? You're going to give them the model so they can imitate it. But potato heads with no parts, for older kids, if they like to draw, paper but no crayons or markers for them to use. A little playground set, say they've loved their little Peppa Pig playground set, give them everything for that set to play with, except, set up the playground, set up the van, that Peppa might have, whatever she has, but don't give her Peppa until she asks for Peppa. You might have a barn with no animals. You might have a toy that has locks, like those cool little houses that have some keys, but don't give them the keys. At home, parents can do this. They can put a kid in an empty bathtub with no water and no toys, and see if their child can come up with a word for water. Or again, I walked you through that process where they might say, what do we need? What do we do? It's time to take a bath. We need to wash. What do you need? And you may even be modeling the sign if they've used the sign for water. Anything you can do, again, to cue that little word. So I want to give you some examples to see, some clips of sabotage. This is my little friend that we just saw in that a clip with choices. Let's watch her again with sabotage, and I want you to always think about keeping this fun and keeping this light. This is not meant to be mean to children, any kind of, evil-spirited here. We don't want to do any of that. We want to keep it light and fun. So watch Rory and watch this cute little clip.
You gonna ride? Ooh,
Ride, 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 ride. Oh, I made it stop. What are we going to do? What? What do you tell Laura? Say it. Say move, Laura. Did you say it? You better say it. Say move.
Move.
Move. There we go. Woo! She's riding. Ride, 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 ride. Oh, get your face. Oh, I made it stop. I made it stop. What do you say? Say move, please.
Move.
Get your lips together, Rory. Move.
Move.
Good job. Move. Ooh, there she goes. You don't want me to stop it, do you? How about I stop it back here? Oh, oh, what do you say? Tell Laura, move, please. Oh, you're going to move it over there. Oh, my horsey. My horsey. Whoa, don't fall. Oh, goodness. I know we're just being too wild today, aren't we? Oh, are you going to make it go? What do you say? Good. Say go, horsey. I see eyes. More eyes. I know. What do we do now? Go, horsey. Good. Go. You just saw that clip of my little friend, and it was pretty easy. She had been in therapy for a while, but I love that little clip, and I wanted to show it to you. Now I'm going to show you some clips with sabotage and withholding when it's not so easy. This is another little friend of mine, and let's just watch these. The first one, I want him to ask for Elmo, the toy that we're using, and he's using some phrases, and I wanted to go ahead and show you here, even though we're still talking about words, he's at the phrase level, but I want you to see how you can really, really use sabotage with a child like this.
Yes, be Elmo.
Let's play Elmo. What happened? I see lights. Whoa, spin, Elmo. Go, Elmo.
I
try. Okay, you try it. He's stuck. Go, Elmo. Go, go, go. Spin lights. Lights go. Oh, lights stop. I want to turn. I do it. Go, lights spin. Uh-oh. Lights stuck. Lights stuck. Go, 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 go. Stop.
I'm sorry.
I try, Elmo. Go, lights. You have to push Elmo's hand. Push Elmo's hand down. Go, lights. Spin, spin, spin. Ooh, up high. Tell Johnny, see, Elmo. You can say it. You say it to him. Say it. Say, see. Tell him. Uh-oh. My turn. I want Elmo. Okay. Spin. Okay, PJ's in there. PJ's in there. Good job. Now what do we do? I close. I love it. Now what? Good. I push. I love it. Push button. Look, water. That tells you the water. More light. That's what you said. More light. See? Uh-oh. Push. I push. Oh, I hear it. It's loud. Loud. Funny. I push. Good. Loud water. Now let me give you some rules for using withholding and sabotage. We've already talked about
Don't be mean, but let's remember that sabotage really isn't effective until a child is already using the word or can at least imitate the word really, really well. So you've heard it several times before you start to use that word as a target for sabotage. We want to be sure that even with sabotage, we keep in mind that principle that we learned back with withholding. We're going to try to cue it or prompt it, whatever word you want to use there, 3 to 5 times before he gets it. And sometimes with kids, we have to back up to choices or withholding before we start to use sabotage. It's more than they can take. And sometimes our little friends with that really low frustration tolerance level, if you see a kid just about to fall apart, don't use it. Save it for when he's more emotionally regulated and pulled together, and it's not going to make him so mad. Let's move on now and talk about vocabulary development. We mentioned this earlier with nouns, and we were saying how important it is to use nouns and how all the vocabularies of early talkers consist mostly of nouns. But at some point, and I found this is when it is for me with the kids I'm working with, I've taught them how to imitate, and they're here at this single word level. They're using lots of words, even words spontaneously. You know, this is generally when mom comes in and says, "You won't believe what he said this week. You will not believe how many new words he learned this week." And that's fantastic. And when you get a kid here, you know he's ready. He's ready for vocabulary development. So this is where we really turn it on. And so and this is where I feel like, oh, I've got this kid. I've got him. We're going to make it. You know, we're here. And so don't leave a kid here just with nouns. Go ahead and start to think about verbs that we talked about, those action words. Start to think about the next kind of part of speech that I work on closely with verbs. I do a lot of work with location words and prepositions. So in, out, on, off, up, down, here, and there. Those are the 8 developmentally appropriate prepositions that we use before a kid turns 36 months. So pay attention to that and really, really get a kid using a lot of single words on his own. Why is this important? Because children have to have a 35 to 50 word base vocabulary that they are using those single words all the time before they can move on to phrases. And so here, right after you get a kid imitating a lot of new single words, don't just jump right onto phrases. Stay here for a while and really work on that spontaneous use. Now, some of you as therapists, that makes perfect sense to you, but maybe you are a developmental therapist or an OT and you're watching this so that you can just be the best therapist you can be and working on language and communication with children, and that's wonderful. But you might think he's saying some words, let me jump to phrases. Don't do that. You need that single word vocabulary really, really firmly established before we move on, because what happens? Then kids get stuck. Then they're stuck at imitation. Then everything is imitated all day long, every day, and they never move to using a word or that word retrieval process on their own. So we want to help a kid get spontaneous there. Now, some experts disagree with this, particularly apraxia experts, because they say this kid's problem is sequencing, and so I want him doing multi-word utterances as soon as he can. And I understand that, but I think those people probably don't work with toddlers like we do. And so they're working with 3- and 4-year-olds who conceptually already join a lot of ideas. You can look at their play, and we talked about this back before, and we're going to talk about it in the next course, but you can see how a child already joins words. And so that's fine. They're developmentally ready. But for lots of our little guys who are still 1 and 2, and we're working on getting these single words established, we need to stay at this single word level for a while. And I get why the apraxia people think about moving on, but generally their kids are a little bit older when they're talking about that, so that would be the difference there. So think about how you can expand what a child can say. All right, so now let's move on and let me tell you what else you can try if these strategies aren't working. And I know the first one I've already said back up, and I'm going to save that to be the last strategy too. Let me first say back up. You're working on something that's too hard, but let me tell you how to do it. You always want to start a session as a therapist cueing words that you know a child can say. So don't start a speech therapy session with brand new words. You're going to always start with old, well-established words. And I'll just tell you, with a kid who tends to be quiet for me, or it takes them a while to warm up, boy, at the beginning, I'm starting with getting them to say their default word or whatever it is. I mean, I start cueing words. If I'm, saw them in my clinic, I was doing that in the lobby when they and Mom were first coming back. If one of their words is open, I'm saying, oh, we got to open this door. Knock, 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 knock. I can't open it yet. You got to say it. Tell me open. And so use all that. If they can't do that word, my point is I'm picking out that default word. I'm picking out something easy for them to say, because that gets them going with that. And again, what I've already said about backing up, that is something you have got to remember. If they can't do the new word that you're introducing, start with an older word. Even sometimes go back to signs. Go back to what we talked about here with the chart, with how we moved a child through this progression. Remember, we're up here way at words. You might start your session with a verbal routine that you've heard kids do over and over and over. You might start with a social game, like Ring Around the Rosies or something, so that we can have a child get there with us and really, again, be in that just right regulatory place, ready to listen and learn and then talk. And so get them there first by backing up. You might use a lot of play sounds and exclamatory words with just a play routine at the beginning of the session, just to get imitation going. And then you move toward using lots of your single words for requests and things. But you don't do that at the beginning if that makes a child shut down. And if you don't hear a lot of words at the beginning, that might be a mistake that you're making. You're starting out at a level that's too high even in your session. So back that up with something that a child can say, and then you're going to move forward. All right, so that's the end of this course for teaching you how to teach a child to imitate new words. I'm going to say it one more time. If these strategies don't work for you after weeks or months of trying, you've missed something. You've got to go back and analyze and figure out exactly where that problem is. If not, look at your materials. It might be your materials, and just so that a kid is really connected with what you're doing. He likes it. And then don't forget that most important piece about he's got to be connected with you. And so you've got to be fun. You've got to be exciting. And with toddlers, we've got to play so that they have their opportunity to use and master and own all those new words that you've taught them how to imitate. All right, that's it for today. I hope you've learned some new tricks in this pretty lengthy course, but I wanted to teach you almost everything I know about getting a child to imitate new words. And so that's it for today. Be sure to go back and listen to those previous shows if you need to. And the links are right there below if you need any of those other resources that I mentioned. If you haven't subscribed to my YouTube channel, I hope that you'll do that now because that really helps us out. All right, that's it for today. I'm Laura Mize, pediatric speech-language pathologist, and you've just watched Teach Me to Talk's podcast, Teach Me to Imitate New Words. Thanks so much.